I'm Timothy Donahue. I am a professor in the Department of Surgery and the chief of the Division of Surgical Oncology at University of California, Los Angeles. All right, so the question relates to how long does it take to fully recover from a Whipple? How long does one have to wait before starting chemo? And if you get chemo before surgery, how long do we wait to do the Whipple? No, the Whipple resection, it is associated with many possible postoperative complications. I think it's thought that, patients have like at least a third or even up to a half have some form of an issue after surgery that usually resolves and can be addressed by specialists or experts. But for the most part, I tell patients that it will take about 6 to 8 weeks or so after the surgery to the point that they're feeling up to resuming or starting their chemotherapy or adjuvant therapy after the surgery. That, in clinical trials that have been done, adjuvant clinical trials for patients and treatments after surgery, they usually allow enrollment from like about 8 weeks after the operation. So it's a good gauge of the time that it will take for one to recover before they're able to start a treatment. Some patients are able to do it earlier, which is fine and great. Even after 3 or 4 weeks, I've had patients who are ready to start with their adjuvant or chemotherapy after the surgery. And so everybody's different, but for the most part, I think what you can estimate is that it's going to take about a month and a half to 2 months to recover, which is not necessarily a bad thing. You have to undergo a big operation in order to remove the tumor. And, I oftentimes tell patients to completely focus on that at that point, it can be overwhelming after getting this diagnosis and thinking about all the possible things that may be ahead of you in your treatment course. But best approach is to try and take it all just one step at a time. And if it's the operation that's recommended first, to do that, and then just focus on recovering from that operation for the next month and a half or 2 months or so, and not worry about starting the chemotherapy, but take that next step once you're ready for it, which is after about a month and a half or 2 months. The time to kind of fully recover from the operation, that takes probably around the 2-month range. The main issue that patients have, and I tell them, is that they're just going to feel tired. You're fatigued for the most part for those 2 months. Naps are common, and just kind of feeling overall tired for those 2 months. But the quality of life studies have shown that patients who have the Whipple get back to pretty close to their baseline quality of life, and so there is light at the end of that tunnel, and recovery is there. The other issue that a lot of patients have after surgery is difficulty eating. It's difficult to eat the 3 normal meals that they do before the operation, and often recommend that patients kind of just go around and snack all day and try and prioritize those protein calories. And it takes at least about that 2 months or so to get back to a normal, regular eating habit and diet after the operation. So fatigue and difficulty with caloric or oral intake is the most common thing that kind of lingers for that 2 months. The last part of the question is if patients are treated before surgery with chemotherapy, occasionally radiation therapy, how long do we wait before we do the operation? We want to give them a good period of time to recover, have their bone marrow recover, and to be able to recover from the surgery. And we usually wait, after the chemo, about 3 to 4 weeks at the very most before doing the next step, which is the operation. Using that approach, I've never seen a patient who has been treated before surgery with chemo have issues related, recovery issues after surgery related to that pre-treatment. Patients oftentimes are concerned that if they get chemo first, that they're not going to be in shape or in a status to be able to have the Whipple resection. But very, very rarely have I seen that. And I would suggest and recommend that not really be the driving factor in deciding whether or not to get treated before surgery. Radiation also is often given before surgery. It's either given in a conventional way, which takes about 6 weeks to give, or in a more focused approach, which takes, an order of 2 weeks to give. We've been giving more and more of the SBRT, or the focused radiation. And it's thought that we usually wait only about 2 or 3 weeks after that to the focused radiation before doing surgery. Concern about radiation is if you wait too long, it can cause some scarring and fibrosis around the area that's radiated, which makes it, that potentially makes the surgery more difficult, an already hard surgery even more difficult. But more and more surgeons around the country have found that, especially with this focused radiation, if you operate relatively early, that's less of a concern. So all in all, the Whipple resection for pancreatic cancer, it's a big operation. Usually takes patients about 6 to 8 weeks to recover to the point where they're ready to start their treatments after the surgery, like chemotherapy. The main symptoms that one is going to feel for that, that last couple weeks before you're at the point where you're ready to get treated are fatigue, and probably some difficulty with eating at least large quantities of food. In those patients who are treated before surgery, don't be overly concerned that getting that treatment is going to get you in a situation where you won't tolerate the surgery, because I've not really seen that. And we usually wait about 3 weeks or so after treatment has stopped, whether that be chemo or the focused radiation, before proceeding with the surgical resection of the cancer.